Hello, I'm Dr. Rudy Kasha. I have offices here in Sacramento and Granite Bay. And if you're watching this video, then you're either considering or you're already set up to see me for a consultation for a Mastopexy augmentation or a breast lift with an implant, is basically what that is. So we're going to talk about that now so you have a bunch of information so that you can formulate some questions if you can think of anything else you want to talk about when we're together. Hopefully this will give you a lot of information, let you know some things that'll be important. So first off, with a Mastopexy augmentation, it basically is filling the breast out, that's the implant, and then lifting the breast. So lifting the breast tissue up so that everything matches. One of the common misconceptions is that a breast lift just makes the breast perky, you never need a bra, all of that sort of stuff. Not really true. It's a little bit true, but not totally true. What a breast lift does is it takes the breast and positions it where it's appropriate. So most of the time in women that have had kids and gone through pregnancy and breastfeeding, the nipple and the breast tissue is lower than it should be. That's kind of an obvious thing. So the lift repositions that back up. And then also through that process of having a child, you lose fullness in the breast. So that's where the implant comes into play. So if we just put an implant in and we didn't lift the breast, the implant would sit here where it's supposed to and the nipple and the breast tissue would droop off of it. Obviously not a good look. So that's where the lift portion comes into play to move the nipple up and the breast tissue up so that now everything is one, basically. The unfortunate trade-off for that are the scars, and that's what happens with a mastopexy. There are various types of mastopexy. There's a periareolar or a donut or a Benelli mastopexy. Those are all the same thing, but that's just taking basically a donut of tissue around the areola and shrinking that in. It has its uses, but we don't like it a whole lot because it stretches out and it doesn't really fully lift the breast, but on occasion that's appropriate. There's also a vertical mastopexy where there's an incision around the nipple and then straight down, or a lollipop incision, you may hear it called. It's not one of my preferred ones. Some people really do like that one. I don't like it a whole lot because it tends to bottom the breast out and you get this really long distance between your nipple and the inframammary fold, which looks fairly artificial. So it's not really a technique I prefer to use very much. The one I do like to use is a WISE pattern mastopexy. You'll hear it called an anchor pattern scar sometimes, and that's basically around the nipple, straight down, and then in the crease underneath the breast. It is a visible scar. It's going to be there forever, unfortunately, but obviously part of my job as a plastic surgeon is to do everything I can to make that scar look good, and there's some silicone gels and things that are actually really quite good. I've been using them for several years now and pretty pleased with what happens. But ultimately, unfortunately, the scar is up to your body. Some people scar super well, some people don't well. Some of that's genetics, some of that is skin type and complexion, all that plays into it. But that's kind of the concept of what's going on with a mastopexy augmentation. So, and the reasons why we do it. So with that, the first thing is the implant. The implant provides the fullness. That's a silicone or a saline implant. I'd refer you over to the breast augmentation video, the consult on that. You can click on that on the website, and I'll go into some details about the implant itself and things to consider there. We talk about a few of the specific issues, things like breast implant related illness, ALCL, different concepts, differences between silicone and saline, how we size, and all of that sort of thing. So watch that breast augmentation video. You'll get some more details on that specifically, but that implant is providing the fullness. So that portion goes underneath the muscle and covered completely by that, and that's where you get your upper pole projection and that sort of thing. All of that determined a little bit by the sizing that we go through. Implants run from about 125 cc's or milliliters to 800 cc's or milliliters. So that provides the fullness, and then the lift is performed. In that portion, we make incisions where it basically repositions the nipple up. We take some vertical skin out and some horizontal skin out, as well as some tissue. So we are actually shrinking the breast at the same time as we're making it bigger. That's one of the concepts. That's why we can't go super big and do a mastopexy at the same time, because they're opposing forces, and that can hurt the blood supply. But we do take that breast tissue out from the undersurface of the breast so that that part that's overhanging basically is gone, and we've got more of the fullness and the projection in the upper portion of the breast. So that's what everything comes out and leaves you with that anchor pattern scar with the breast lift. That gets you the shape you want, the fullness that you want, and really basically improves the aesthetics of the breast. Risks, just like with any surgical procedure, there are risks. This is still a fairly common, fairly simple, fairly straightforward procedure, but there are risks that go along with this that you want to be aware of. Typical things like bleeding, infection, all of that sort of stuff. There's risk of a hematoma where there's bleeding underneath, so we'll talk about some restrictions that you need to do afterwards. There is risk of healing problems, so we're making a lot of incisions, so that's a common thing to know. It's not common to happen, but it does happen every now and then where you get a little healing spot underneath where it's the tip of the skin flap that's not getting as much blood supply. That's why things like smoking are very important, that it's not happening because that decreases blood supply as well and can further increase your risk of that. It's also why we can't go huge in the implant at the same time as doing that, because that can also increase your healing risk problems. There's risks of some numbness, sometimes underneath, and in some places that will be normal and happen, but there's also risk of loss of sensation to the nipple itself, so both from the lift portion and the augmentation portion of the surgery. With the implant, there's risk of capsular contracture, which is a scarring that can occur around the implant. You can hear a little bit more about that in the breast augmentation video. There's the risk, basically. Oh shoot, I just zoned out. Should I start risks again, or will you be able to cut into it?
Start out. Well, whatever you just said with smoking and all.
Okay.
Keep that, and just start at that.
Okay, so just kind of pick back up. I kind of forgot what other risks I wanted to talk to him about. Okay, all right. One additional risk, very, very rare, but it's a risk of what's called pneumothorax. So with any breast augmentation type surgery, there's risk that you could, basically the tissue that lines between the ribs themselves, in a very thin person, sometimes that can be cauterized as we're cauterizing the blood vessels there, and it can make a little small tear in that area. You could get a little air that travels around the lung. Usually that's something we would notice. We put a little suction catheter in, suction that air out, and then follow you up afterwards with some chest x-rays at times, or sometimes just clinical exams, but that's one thing to know as well. There's a bunch of paperwork you'll read as well that has all kinds of stuff. It's gonna scare you to death, but that's the typical medical legal paperwork that we always have to do. But those are the key things that you want to know. All in all, very safe surgery, very straightforward surgery, and something with great results that patients, especially moms that have been through pregnancy, can benefit a lot from. A recovery afterwards, it's very similar to a breast augmentation. So the lift portion itself really doesn't add much pain or recovery, because that's just basically a skin surgery. Even though those are the bigger incisions, it's skin tissue, that's not what really hurts. It's the muscle part that's sore, and that's what's lifted with the implant. So same basic recovery instructions and time period as a breast augmentation, which is most people would take about a week off of work, and then 6 weeks of restrictions. So no heavy lifting, no rapid arm motions, no cleaning the house, no vacuuming, no pushing yourself up, no pulling yourself up, because we don't want to create a hematoma, which can necessitate going back to the OR. So those are key things with that. You'll wear a surgical bra that we'll give you, that you'll wear for the 6 weeks, and then after 6 weeks you'll be able to wear regular bras except for underwires for 3 months. The surgery itself takes about 2.5 to 3 hours. Spend some time in the recovery room after that. Then you go home. You'll come see me 1 to 2 days afterwards to check on things. You'll shower at the second day afterwards, and then kind of go from there sequentially with certain follow-up visits as we go along. But overall, great surgery, makes a really nice difference. Definitely helpful dealing with pregnancy and breastfeeding afterwards. But during our consultation, any further questions you may have, we'll talk through that. We'll do an exam as well, and I'll give you some recommendations and specific points for you to consider as well. So thanks so much. Hopefully that was helpful and gave you some information to start the journey, and I look forward to meeting you.